Heart and blood vessels. Part 5. Problems with regulation of blood pressure and other heart-related problems. Problems with regulation of blood pressure. Cardiovascular disease includes hypertension, arteriolysis, atheriolysis, heart attack, stroke. Hypertension is prolonged high blood pressure due to various factors such as heredity, stress, diet, and sodium. High blood pressure weakens the wall of the artery, and over time, the body may try to repair the arteries with an additional connective tissue. Unfortunately, this makes arteries less elastic and increases blood pressure. Sometimes the heart beats too fast to effectively pump blood. Any irregular heartbeats are called arrhythmia. If a coronary artery is blocked, cells in the heart are not getting enough oxygen and nutrients, and the waste builds up within the cells. Instead of beating in response to the signal from the SA node, the cells of the ventricle will individually respond to the build-up of toxic waste and beat wildly. This is called ventricular fibrillation. The heart simply pushes blood back and forth. In times of stress, your adrenal glands release the hormone epinephrine. This hormone causes the spleen to release red blood cells and causes heart rate and breathing to increase. Arterioles in the heart, brain, and muscles vasodilate, and so they get bigger. And arteries in the kidney, stomach, intestines vasoconstrict, so they get smaller. In this way, the body can quickly respond to stress. So that means you have more blood going to your brain, heart, and muscles than your kidneys, stomach, and intestines. That's why you don't have to pee in times of stress. The condition when the heart valves do not close completely and blood leaks past the closed valves is known as a heart murmur. This can be detected with a stethoscope, which detects a gurgling sound. Blood flows in the wrong direction, which decreases the blood flow in the systemic and pulmonary circulatory systems. Circulation. People with heart murmurs compensate for this decrease of oxygen delivered by beating faster. Also, the heart gets stretched or enlarged because we have an increased volume of blood that's being pumped. So the volume of the leaked blood plus the volume of normal blood flow. The enlarged heart beats with a stronger force. Therefore, increased blood volume being pushed with greater force by a faster heartbeat helps to compensate for the heart murmur. Edema. Fluids flow into and out of capillaries and spaces around cells through extracellular fluid, also known as ECF. Blood pressure helps to force fluids out of the capillaries, but large molecules, such as protein molecules, cannot pass through semipermeable membranes. Needed water and minerals flow out of the capillaries, but they absorb back into the capillaries through osmosis. The concentration of water is greater in the body cells than in the capillaries, so water through osmosis moves back to the capillaries. The higher concentration of proteins in the capillaries is essential to balance the flow of water out of and back into the capillaries. But edema can look like this. So when an individual suffers from starvation, like in the previous photo, the body will start to use the blood proteins as food supply. This upsets balance. The reduced concentration of blood proteins lowers osmotic pressure, which is a pressure that causes water to be absorbed back into the capillaries. Water enters the tissue space and less water returns to capillaries. This water in the tissue space causes swelling, known as edema. And this is why starving children may have extended stomachs.